ACL tear, what does it mean? It means there is a ligament which connects femur to tibia. There are two bones, third one is the patella. When it gets torn, then we have some kind of symptoms initially. Those symptoms is known as instability. So you will not have any kind of pain while walking, no discomfort while walking. But whenever take a sharp turn, try to take a long jump, you feel that your knee is not stable. It is going giving up. Eventually what will happen by doing this kind of motion, there will be degeneration of cartilage and the meniscus. If the meniscus is torn during the injury, then it will get torn more. If you don't get treatment for the ACL tear, the knee will degenerate. As in your case, the ACL got torn many years back, and because of the era at that time, we did not take any treatment. So now the cartilage is gone out. If I see in the MRI, there is a big hole in the cartilage as well. So initially the ACL is torn, then eventually over years, the meniscus and cartilage has gone out. Still, we have a chance to save the knee. So many of the doctors will tell you to go for a knee replacement because of age and everything. You go for a knee replacement. That is also a good option in your age. But if you go for a knee replacement at 56, then you have to again go for a knee replacement at 76 or 75. It will stay for 20 years. And it's a big surgery, an artificial thing. We can do one thing, that we can reconstruct your ACL, we can do the meniscus repair, and we can do the cartilage transplant. These three which we can do to give you a better life. And this can stay for life. Because of the age, I have a choice of giving you an artificial ligament. So when I talk about the synthetic ACL, we have two companies which is in India. One is Joel ACL and one is Lars. So what is the difference between Joel ACL and Lars ACL? That in Joel ACL, as you can see, the ACL is knitted. Knitted मतलब इसमें ऐसे crossed, knitted है सारा ऊपर से नीचे. This option is only for people who are above 50. I don't want to use synthetic ligament in younger people. Better stability, it should stay for life. So synthetic ligament is very good, but only for the older people. Lars is the oldest company in the world, but it is recently introduced to India. These are the pioneers in synthetic ligament. The only difference between Lars and Joel is this, that is Joel, the whole construct is knitted because the movement happens in the joint. So whenever we do ACL reconstruction, there are three parts of ACL. One part will go into the femoral bone, one part will stay in the joint, and one part will go here. It's like this. So knitted should be there in the bone so that we have a better bone to synthetic ligament integration. But whenever there is a movement inside the joint, the knitted construction can cut each other. आपस में काट देगा उसको. So better है that we use this ligament in which the knitted is there in the bone, but in the joint intra-articular portion it is linear. And this is linear and twisted. In ACL also the ligaments, the fibers are twisted. So it mimics the original ACL, and eventually over time this configuration encourages the fibroblast and collagen growth inside the synthetic ligament. So this will become like a normal ligament eventually, like a growing tissue. It will not be a synthetic alone. There will be growth of the tissue and it will become a living ACL, and it will stay for life. We fix this with one screw below and one screw on the top. So this is how we do a synthetic ligament ACL reconstruction. Very simple. It's easy. Why? Because I don't have to take out a graft, so there will be no weakness of hamstring or parietal tendon or any quadriceps. We give a ligament. We can be non-weight bearing. We can, with the help of a crutch or a walker for 3 weeks, and then he can put weight. ACL rehabilitation is structured phase 1, phase 2, phase 3, phase 4, phase 5. So rehabilitation will go for 6 months. We will call him every week over phone, or if he can come, then it's very good, and we teach on exercises. So whenever we delay the ACL surgery, there is a damage in the cartilage, as you can see in the animation. It is not possible to correct the whole damage. It is a big reason. And this is a punched out defect. This is the osteochondral defect which happens during the injury. In your case, it is degenerating. So we'll try to replace the cartilage as much as possible. Maybe we'll give the 2 plugs. So I will measure the defect, and then I will take out a graft from here. This is a non-weight bearing surface of femur. I will take out from the non-weight bearing area of the femoral surface and put it here. This is a new instrument which has come, is OATS. Then we talk about the meniscus. So meniscus looks like this. This is the meniscus tear. In his case, because he is walking over the meniscus tear, it might be something like this over the years. So we will take out some of the meniscus which is absolutely non-repairable. The rest of the meniscus I will repair with zone navigator and blood clot. So we will try to make a blood clot. We'll put inside the meniscus, because without the blood clot it is very difficult to heal the meniscus tear. And then we are going to repair with zone navigator system, from which we can repair with the tapes. So cartilage transplant, meniscus repair, and synthetic ACL reconstruction. These three.